My name is Travis Holcombe. I'm a surgeon in Phoenix, Arizona. I want to present a message on everything you need to know about the Ebola virus and what we, as a country, need to do about it. I have a particular interest in this crisis because my daughter is a nurse at Texas Presbyterian Hospital here in Dallas, locally known as Presby. I am not an expert. I'm not an epidemiologist. I'm not an infectious disease specialist. But I am well educated. And I'm unsatisfied with what has been articulated about this crisis thus far. My message is that this is a very deadly disease with a mortality rate of 50 to 90%. That means that if you have 100 patients with an Ebola infection, this viral infection, up to 90 of them will die. We have no cure for this disease. We have very limited and basic treatment, which is only the giving of fluids, either orally or by an IV. I believe we need to isolate the epidemic to save lives. As a medical community, we have known about this disease since 1976. There have been several outbreaks. The total number of dead from those outbreaks over the last almost 40 years is about 1,600 patients. Already, with this outbreak since March, 4,400 folks have died, and many thousands more are expected to die. The outbreaks before this one were limited by rapid death of people and by the localized nature of these outbreaks. This outbreak is different. It's much bigger. To me, that indicates that either the circumstances of the outbreak are different, such as easier ability to travel and that sort of thing, or the virus itself is different. There are 5 known species or strains of the Ebola virus. This is the Zaire strain, the one that was originally discovered in 1976. We do know that transmission is by contact with body fluids, such as blood, vomit, or feces, via an open wound or mucous membranes, intact mucous membranes of the recipient. At least that's what we have understood up to this point. Up to a week ago, I assumed that this was a disease of poor African countries where healthcare is minimal. Through the experience here in Dallas with Mr. Duncan, Nina Pham, and Amber Vinson, we now know that that is not the case. That even in America, in one of the finest hospitals we have, Ebola can spread. We have always led as a country, and this is a time where we need to lead. There are 2 issues for me. One is, how do we treat the patient? And secondly, how do we treat the epidemic? The current treatment of patients is, again, limited to fluids and isolation. The epidemic would seem obvious to me, since we have no cure and we have no approved treatments other than fluids, is the same, that the epidemic has to be isolated. The current approach for limiting the spread to other countries, particularly our country, is to interview travelers to see if they have any history of contact with patients with Ebola or healthcare workers who have taken care of patients with Ebola, and see if they have a temperature. Unfortunately, we as people, as humans, will lie, even for a matter of convenience. And it'd be very easy to take Tylenol or aspirin or Motrin before you had your temperature taken, and a low-grade fever would be suppressed. So it'd be very easy to get through the net. I believe that we need to draw a circle around these three countries where the epidemic is raging, and allow travel from the country only after a supervised 21-day quarantine. That is how we can best limit the spread of the epidemic. I believe this would result in the savings of thousands of lives, not only American lives, but African lives and lives throughout the world. I am proud of my daughter, and that she is willing to work in a hospital where the Ebola virus is a risk. This has been a part of care as a doctor or nurse for hundreds or thousands of years. It's only been recently, by that I mean probably the last 100 years, that the risk of our own health, of our own lives, has been so small. And I'm also proud of our country's initiative to send our troops to build infrastructure to take care of these terribly sick folks, to serve them. And even for those of us who will go over to help, they also would need to undergo a supervised 21-day quarantine. A couple other things I just wanted to touch on, because I think there's misconceptions for us Americans. There are some experimental treatments. I'm so grateful that Nina could get this serum from this aid worker who survived. But we don't know if the experimental treatments have actually worked or will work. You see, Nina may have been in the 10 to 50% that would not have died anyway. It's going to take time to develop proven treatments. It's going to take time to develop a vaccine. The public wonders why we don't have a vaccine so far. Well, it's because of that fact I mentioned earlier, that such a small number of people have died, 1,600 over 40 years. There was not enough motivation, particularly financial motivation, on the part of the pharmaceutical companies to develop a vaccine. I'm sure that will change, but that's going to take time. The last thing I wanted to mention was our precautions as healthcare workers. As the medical community has understood this disease, wearing basic contact isolation, gloves, mask, a simple gown has been enough to really limit the transmission. With Amber and Nina's experience, I'm not sure that that thinking is accurate. These were two very well trained ICU nurses. Even though they did not have the diagnosis of Ebola yet, when they probably contracted the illness, I would guarantee that they were wearing gloves each time they interacted with a patient or his body fluids. Which makes me wonder what is different about this virus that these two young, healthy girls contracted it, and none of the experts have been able to give us that answer, which to me would motivate us even more to isolate the epidemic in West Africa to save thousands of lives. And I think that we can do that fairly simply. Great inconvenience. I don't think it would be an offense or a slight to these countries. A great inconvenience, but a very effective way to save thousands and thousands of lives. So I would encourage you who may be watching my little unsophisticated presentation to contact our national leaders, our congressmen, senators, the White House, and encourage them to lead the international effort to end this epidemic through isolation. Of course, we don't have the authority to draw a circle around these countries completely. We can draw a circle with regard to America. Dr. Frieden, the head of the CDC, stated yesterday at this House subcommittee meeting that he felt it would be counterproductive because if people were not given access to our country from these places, they would find other ways. The implication was over land through Canada or Mexico. The representative from Louisiana pointed out that if that were to happen, instead of 150 a day, which I believe was the estimate coming now, wouldn't that number shrink? Maybe 4 or 5, and wouldn't that be better for the safety of our country? And so if we isolated travel to our country from these countries through this supervised 21-day quarantine, because that's the incubation period for this disease, I would guess that other countries would follow. Many other countries already have such a ban, but we have the ability to make it happen. I've listed my phone number of a little throwaway phone that I bought today if anybody would want me to present this, if it's been helpful. I would try to do that for you. Thank you for watching.